I think the state got to this point how the nation has gotten to this point. Back in the 70s and 80s, you know, we worked on deinstitutionalization, and you have very few state hospitals in Florida now, and everything was supposed to be community-based. And then guess what happened? It didn't become community-based. It didn't get funded. There weren't the safety nets. So then you have all these folks who need treatment, and they can't get it because it's an underfunded system. I think in Orange County we're very, very fortunate to have the system of care we have, because we've been able to do some pretty innovative things. We've had support from the mayor and the Board of County Commissioners to continue to support innovative practices like our Central Receiving Center. That's a model that's been looked at all over the state. We have out-of-state people that are coming to look at it from Minnesota, actually, that want to replicate the model. We got the Sheriff's Association wanting more information about the CRC and how that keeps people from going to jail that have serious mental health issues. The CRC is a model that pretty much, it's a central point of access for people in crisis that law enforcement come in contact with that normally would have been arrested, 12 years ago. And now they take them to a central point of access, and we keep them on the treatment side of the system rather than the criminal justice side of the system. And that saves, human capital, and that saves our jail from having to treat those most vulnerable people. And that also keeps law enforcement back on the street and not tied up in busy emergency rooms and booking areas for hours at a time. When we get a hit that somebody is coming through the CRC pretty regularly through crisis systems, we make a concerted effort to send someone to engage them and talk to them about services after they leave, and make a plan for them after they leave, so that we're looking at transitional housing if they need it, we're looking at permanent supportive housing if they need it, we're looking at trying to get them their benefits started right away so they have Medicaid and all those things that they need to support them in the community. So that starts immediately. And we've had 6 care coordinators up until this year, and we got some extra funding from the state this year, thanks to Senator Gardner. And we're actually going to be expanding our care coordination unit for another 3 care coordinators, which will give us the ability to help more folks get out of that kind of recidivating model of coming through so many systems. And these are folks that used to cycle through all the time, going through the CRC, going on the crisis unit, going on a detox unit, going to jail, going to the hospitals. And that intervention, we've had about an 85% success keeping them out of those deep end services. We're looking at a partnership with Florida Hospital really soon to do mobile crisis. The mayor is very interested in mobile crisis, because we realize if you can intervene with those kids very early, they don't end up in the juvenile justice system, they don't end up in your crisis system, they don't end up in your foster care system, and you keep those kids in their families and you work with their families. And that's a best practice. So things that are happening that we're doing in Orange County, very exciting, in that we're doing Wraparound Orange with kids, and even after that federal grant ends, the mayor has committed to keeping that program going. So we will have general revenue dollars in making sure that program continues, because the outcomes have been so good with that program. With the new money that Senator Gardner helped us get, new state dollars, we're actually looking on replicating a model that they have in Miami-Dade called the Recovery Community, where consumers actually take control of their own lives and their own recovery. They do a wellness recovery action plan, and consumers help consumers, and they train consumers on how to do their own plans, and that works so well for them, because then they understand their own wellness, they understand their disease, and they take control of it. And that, we're really excited about that, because that keeps consumers engaged in their own care and helping them help others. And that, unless you have this illness, you don't understand how it affects other people. But peers helping peers is really a positive for us. So we're looking forward to how that rolls out. Mental illness is just another disease, and we have to start categorizing it that way and working on it the same way we do other diseases.
Orlando sitting on newspaper, check it out, yeah, do us the favor, promise that you will love it later, I promise, we got Central